All right, we're going to actually knock out a couple chapters, chapter 3 and chapter 4. So let's start 3, informed touch. We're going to go over myofascial pain and palpation skills. So surface palpation is the most overlooked assessment skill. Our hands can typically tell us the alignment of joints. It can feel the skin or body temperature changes, right? And when you're palpating somebody successfully, you must be able to visualize the anatomic structures below that you are palpating. So healthy tissue and trigger points. Muscle tissue that is pain-free when it's palpated is considered healthy. I know you guys have heard that before. Discomfort may indicate a constricted muscle or fiber. So a trigger point is a constricted or harder area that causes pain when palpated. Excuse me. Typically there's local pain, and most often there's radiating or referred pain. That is basically what a trigger point is that localized or referred pain. A contractor, also known as a contracted muscle. So if you see contracture, it also means the muscle's contracted. May be the result of a neurological dysfunction, some kind of structural imbalance that's a chronic structural imbalance, trauma, or extreme repetitive strain. When this happens, the circulation is reduced. You have a contracted muscle, maybe due to trauma. Circulation is reduced. It causes the muscle to become more fibrous and more rigid. This causes a lack of blood, lack of oxygen and nutrients to the tissue. And that's where our job comes in. So effective palpation skills. Again, imagine the structures of the tissue that are being palpated. This will help with anatomy, trying to remember the muscles below. Use soft hands. Soft finger pads. We're not going to be palpating with the tips of our fingers, making it poking and uncomfortable. Use as broad of a surface area of your hand as possible. We're going to use the palmar surface, not the fingers again. As you're palpating, you can identify what seems like soft tissue and bone. Try to find the bony landmarks. Bony landmarks kind of tell you what muscles are involved and if there's dysfunction in the joint. Palpate at least 2 directions. You want to go along the fibers and against the fibers. You can go diagonally if you want. So just try different directions to see where there might be a restriction. You'll kind of feel the tissue not want to pull in that or be pushed in that general direction. Limit pressure to the point of resistance. Remember, if you use too deep of a pressure, it can cause the client to tighten the area and kind of try to pull away. If you go too light, it may not give you a great deal of information, so you might not be feeling anything. Again, always compare bilateral sides. Maybe somebody's coming in because their right shoulder is tight. It hurts. Well, you want to make sure you know what normal is, so the left shoulder would be considered the normal that's not dysfunctional. But you might also find that there's a lot of issues there causing the right to have more issues. So everybody's different. Well, that was fast. All right, so that was chapter 3. Here's chapter 4. Diagnosis and treatment. So observation. Our diagnosis and assessment starts as soon as we see that client, remember. As they're coming into your office, kind of watch them how they walk. Don't be weird about it. Just make it natural. Watch how they walk naturally. Because if you tell them, Okay, stand across the room and walk to this area. They're going to purposely walk a certain way or be mindful of how they're walking. You don't want that. You want to see what their natural gait is. See how they stand. Maybe they're standing and one hip is kind of popped up a little high. Uh, or, they're standing with more weight on one leg and the other is maybe one knee is straight and the other one is bent, right? So watch that. Look at shoulder heights. Watch how they hold their hands. Are they crossing their arms? Are they holding their hands out? Is one hand rotating laterally, right? So look at all that stuff. See how they cross their legs. Maybe they're filling out their form or they're in the waiting room and you notice that they are crossing a certain leg. Chances are that is a repetitive motion that they do often when sitting. You might want to watch how they read their intake form or fill out their intake forms. So just that posture. You might notice they're rubbing their neck or rubbing an area that might hurt. Or how they carry their purse. That's a big one for people who carry purses, bags, briefcases, backpacks often. That'll start having an impact on the function of your posture. And there's a lot of other things you can kind of look at too. The fun thing here we're going to do is the shoe wear. So we're going to want to identify patterns of wear. And the easiest thing to do is look at an older pair of shoes. So if your client comes in, you can even ask them if they have an older pair of shoes, if you can look at their shoes, right? It is rare to have muscular constriction and trigger points exist in an isolated or single muscle. So usually, you hear a lot of times that people say the problems start in your feet. Well, that is kind of true. Not most of the time, often, right? So if you pay careful attention, it can reveal a great deal about the structure or the dysfunction of your posture or your client's posture. So this is why we ask questions about jobs and hobbies and how they spend their time, because that's really important to try to figure out where the start of that dysfunction may have been. And shoe wear can provide information on gait. So in this picture over here is a pair of worn down tennis shoes. You'll notice the tread on the tennis shoes is almost smooth, especially in the the ball of the foot. And you'll notice maybe somebody pronates or supinates their foot and that's worn away, or a certain heel is worn away on one side more than the other. So that kind of tells you how their foot strikes as they are walking or running. And how your foot strikes can affect everything all the way up to your head. This is a little hard to read here. Sorry, I should have chose a better font. But shoe wear, normal shoe wear is on the top here, middle, okay? So pronation is the normal movement of the foot when walking or running. The foot rolls inward minimally with each step. So, middle, this is how your foot should be aligned. If you were to look at your footprint, this is what it'll look like. You'll have the, since we're slightly in a pronation, all right, we will have the arch of the foot being shown. All the toes will make contact. The ball and the heel will make contact as well. And then if you look at the shoe wear, normal shoe wear will have an even amount on the heels and the ball of the feet. All right. Then we have something called excessive pronation, which is over here, or hyperpronation. And then to the right, we have supination or underpronation. So let's go to your hyperpronation over here. So when you are hyperpronating, remember supinating, you're putting more weight on the outsides, right? Pronating, you're putting more weight on the inside of the foot here. You'll notice that since there's more weight on the inside, you're not having this little arch gap anymore. So you got a full print of the foot, basically. You'll also notice if you look at the shoe wear, most of the weight, again, is on the inside part of your foot. So this is common with people with flat feet. All right, it creates a twisting motion, which the toes do most of the work at that point, and it could be associated with knee pain and shin splints. Here's your supination or your underpronation, since normal is a slight pronation, right? So supination, this is when the feet go slightly in, like you're trying to, grab a bowl of soup with your feet. Excuse me. When we are supinating or underpronating, we're not making much contact with the arch of our feet. This is bad. Most of the weight is going on that lateral part of the foot, right, and the heel. This results in increased pressure on the outer edge of the foot and toes. It's more common with people with a high rigid arch, and may be associated with IT band syndrome or stress fractures. So typically if somebody, walks a lot on here, their IT bands are going to be tight. If their IT bands are tight, chances are, their TFL is going to be tight, and maybe their hip flexors, and then there's a whole thing, right? So, evolving palpation skills and listening closely. Skillful palpation is the singular most important component of treatment. We want to examine left, right, above an area, below an area, anterior, posteriorly, and apply pressure gradually. Don't just go in with the palpation skills all pokey and painful and deep. Clients will often remember pains during the treatment that were not previously mentioned. So sometimes I might be laying there and they're like, oh yeah, I forgot about my plantar fasciitis, right? What they feel, when, and how extreme are very important pieces of data. Many people with chronic pain have been told that the pain is in their head or isn't real. So that is a common thing that doctors say when they're not quite sure how to diagnose somebody, which is actually really sad. Often more than not, chronic pain can be associated with like an autoimmune disease. So a lot of inflammation. So we are wanting to treat with precision and attention. When we're treating someone, define the area of pain and movements that cause this discomfort. This is why we're learning anatomy, because if you have maybe discomfort rotating your head to the left, it might be caused from your SCM, maybe on the right. Remember, the SCM rotates with the opposite side. It doesn't really, just the positioning of that muscle. Utilize pain patterns and what muscles are involved. Palpate taut bands and constrictions, but do it gently. Remember, broader is better. Palpate the entire body to determine associated constrictions. And locate and define specific trigger points. If you find them, you can maintain ischemic pressure until softening is felt. Now, it's not some magic thing you're going to feel, but with pressure and, manual therapy, It is causing a mechanical effect with the body and causing the muscles to soften a bit. So that's kind of what you're feeling, is the softening of the muscle. You could also apply moist heat to increase the blood flow. You can provide a stretching routine for homework for your clients. A lot of times, if you do that, I would suggest either having stretches printed out for them or already have like I don't know, a playlist of YouTube videos you can share, or showing them before they leave. Like literally doing the exercise with them or stretch. You can also suggest a strengthening program for the affected muscles. If they're working alongside maybe a PT or an athletic trainer, you can get a release form filled out and share information between their other practitioner, right? Teach your client to breathe. If they learn how to properly breathe, they might get better, oxygen throughout the body and help with relaxation, kind of engage the parasympathetic system, right? So when they're breathing, remember to breathe in through your nose. And as you breathe, your belly is actually going to raise before your chest. So that's important. A lot of times people will try to breathe and just suck it in and their chest expands. That's not really the correct way to do a deep breath. Here it is. So poor breathing patterns can directly affect your myofascial patterns. So if you're doing a breathing exercise, you can sit, stand, lay, whatever. I wouldn't really stand because sometimes when you deep breathe, you get a little lightheaded. So if you can't lay, sit down, right? Relax your body. Start with the shoulders and chest. Relax the abs and the glutes, the arms, the hands, the fingers, the legs, the toes, right? Breathe in slow. Expand the abdomen before the chest rises. So you're going to take, we'll say, 3 seconds in through your nose. Expand the belly and the chest, and then exhale. Empty the upper portion, then the lower. Keep everything relaxed and repeat. So you can do counts of 3 or 4, whatever you would like to do for inhaling and exhaling. You can do this with the client on the table. You can start or end your massage with breath work if you like, if that's what you're into. Or you can ask your client, would you like to start with some breath work? Because some people might not want to, right? So the client might need to practice in front of a mirror until they get better at this, if this is something they want to incorporate into their wellness journey. All right, that's it. So practice your deep breathing and practice helping people with their deep breathing.